Likely heard of knee and hip replacements, but how about a wrist replacement? Well, it's a real procedure.
That's right, it's just not as common, but new technology and improved techniques are helping surgeons perform this procedure. Channel 5's Naomi De Lucia explains in this morning's Medical Breakthroughs.
Wrists, they can move any which way. They're made up of 10 small bones and 3 joints.
Move slow.
The wrist joint is composed of the radiocarpal joint, which is the wrist that goes back and forth. But people don't realize that the other half of the joint is this joint.
And when one of those bones or joints goes bad, people can be left in pain. But until recently, doctors could do little to help.
The way we would treat this is we would remove that bone and literally throw it away. And then we would pray that the connection between these two bones would be restored. But it really would never be truly restored.
But now, hand specialist John Fernandez at Midwest Orthopedics at Rush is one of the few surgeons in the country to replace the distal radio-ulnar joint with a metal implant.
It's like putting the hinge back on the door, so now the door can open properly. And what's most remarkable is you see these patients 2 weeks later, they have no pain. And these are patients who have been in pain for literally 20 years. They've had 5 or 6 failed surgeries.
And the best part? No rehab.
There's none, because you haven't touched the muscles, you haven't touched the tendons.
Within 2 weeks, patients are back doing what they love, active and without pain.
The only restrictions, no heavy lifting. If you're younger or have a job doing heavy work, wrist replacements may not be a good option. Doctors are now working on how to replace the other main joint in the wrist, which is the radiocarpal joint. With your Medical Breakthroughs, I'm Naomi De Lucia with Channel 5 News.